Good evening, everyone, and welcome to our webinar this evening. I am Dr. Vicki Gomez, Program Director of the IDEA Center, and I'll be your moderator for this evening. This webinar is part of a series called Parenting in the Pandemic series. It's co-sponsored by the IDEA Center in the UC Davis Office of Diversity, Equity, and Inclusion, the Healthy YOLO Together program, the Healthy Davis Together Public Health Project, and also UC Davis Health. The goal is to stop the spread of COVID, keep families and children and people safe, to provide evidence-based information, largely to counter misinformation, so that vulnerable populations that are most impacted by COVID can receive accurate and clear information. Also, we will answer your questions so that you can make choices on how to keep your children and families safe, and so that they can continue to learn and to thrive both at school and at home. We will offer more of these webinars so that as information changes, we'll strive to keep you up to date. We encourage you to ask questions in our Q&A box that you see at the bottom of your screen, and we'll have an opportunity for you to do that once our panelists have spoken. And so now I'd like to introduce our panelists. And I'm going to start with Dr. Michael Lucien. Is a pediatrician at UC Davis Medical Center. He grew up in the Sacramento area and graduated from Hiram Johnson High School. He completed his undergraduate degree and master's in public health at UCLA. Dr. Lucien graduated from UC Davis Medical School and completed his pediatric residency there. And he has worked for 26 years as a general pediatrician for UC Davis Health. And our second panelist I'm going to introduce is Patrice Hill, and she is the director of Sacramento Area Youth Speaks, also known as SAYS. Patrice Hill is an administrator, poet, scholar activist, educator, and teaching artist who has over 2 decades of experience teaching in urban, suburban, and exurban classrooms in the greater Sacramento area. While studying Pan-African Studies at California State University, Sacramento, Ms. Hill made a commitment to focus her personal and professional work on serving the youth of her community. Ms. Hill currently serves as the director of Sacramento Area Youth Speaks, also known as SAYS. And so now we'll begin with Dr. Lucien.
Thank you, Vicki. It's a real honor to be able to speak to you guys tonight. Hopefully I can share some information that will be beneficial to everybody, and then hopefully stimulate a lot of questions so that we can answer some of the many questions I'm sure many of you may have regarding COVID-19 and the vaccination. So I'm going to start by sharing my screen here. Okay. Technology, right? So we're going to be talking about COVID-19, particularly a look at the effects in the Black youth community. So just as a little background, COVID-19 is a disease that is caused by what we call SARS, which stands for Severe Acute Respiratory Syndrome Coronavirus number 2. So SARS-CoV, that virus, is what we call a novel or new virus. And as best we can tell, it was first discovered in China some point towards the late part of 2019. Why is this significant? Well, because it is a new virus, the populations of humans around the world do not have any previous protection against the virus. Now, many of you may have heard of coronaviruses before, but if you haven't, coronaviruses are actually quite common, and they are responsible for a number of cold-like illnesses over the years. What is unique about the SARS-CoV virus, CoV-2 virus, is that it has shown that it has the ability to cause a much more severe even deadly illness compared to the other viruses, and seems to be much more easily able to spread from one person to another. So if we look at the number of children, we find that since recently, the number of children who are being diagnosed with COVID-19 has increased. And there are a number of reasons why we have seen this increase. One of the reasons has included the reopening of schools as well as daycares. Another is the emergence of what we are now known as the Delta variant, which has now become the most common variant of the COVID virus throughout the world. It is known to be much more contagious, considered to be anywhere from 2 to 4 times more contagious, which means it's more easy to spread from one person to another compared to the previous variants of the SARS-CoV-2. The other thing is that we do know that, and this is why we're talking about this today, is that COVID-19 disproportionately affects children of color. And more importantly, that Black and Latinx children are much more likely to be hospitalized and much more likely to develop what we know or call MIS-C, which stands for multi-system inflammatory syndrome of children. So if we look at all of the cases of COVID in the US, about 16% of those are in children. And that has now resulted in over 6 million cases, with some states, as many as 12 of them, showing that 20% of those cases of all the people who have gotten this illness are actually children. A little bit more about MIS-C. It is a serious and unfortunately sometimes deadly condition where different parts of the body become inflamed. Examples of the areas that can show this inflammation are the lungs, the heart, the kidneys, and the brain. And we do know, based on all the reporting, that Black children are more likely to be admitted to the ICU, the intensive care unit, due to MIS-C compared to the other ethnic groups. And furthermore, that Black children, along with Latinx, American Indian, and Alaska Natives have higher death rates. And so I'd like to show you exactly what the statistics those are. These have been obtained from the Kaiser Family Foundation, and they go up until the end of August of this year. And if you look at the cases, and the cases are reported in children between the age of 0 and 19, and it's per 10,000 of the population. And you can see to the far right, where my pointer is, that the highest number is among the American Indians and the Alaska Natives, and among the Native Hawaiians or other Pacific Islanders. The next group in terms of number of cases is Hispanics. And in fact, if you look at the Black population, the number of cases is actually lower than the white population. And the only population that had a lower number of cases is the Asian. However, if we go from the cases to the hospitalizations, things start to change. You can see that the Asian population still has the lowest number. The whites are a little bit higher. Still, the highest numbers are the two groups that we particularly had talked about, the American Indians and the Alaska Natives, as well as the Native Hawaiians. But now the Black numbers is up at 56.9 per 10,000, and it's almost as high as the Hispanics. And as we go to the final slide, and we actually look at deaths among the population, now this is now not per 100,000, but per 1 million, we can see that the American Indian and Alaska Natives has the highest at 13, but suddenly now the Black population is number 2 at 13.8. And this is why it's so important to have an important understanding about the risk factors related to obtaining and what you can do to try to prevent your child from getting COVID-19, because there are a number of reasons to explain this, and I'll talk about that briefly, but the statistics do show that one, Black children, if they do get COVID, even though they don't get it at the same rate as some of the other high-risk populations, have a higher risk of being placed in the hospital and developing complications that may result in their death. And why is that? Well, one, let me start by saying there is, without a question, the best and the most effective way to avoid the infection from COVID-19 is the vaccine. I know there are a lot of questions people will have about, is the vaccine safe? And we'll talk and answer those questions. But if you look at all of the information, it shows that people who are vaccinated are 6 times less likely to get the disease compared to people who are unvaccinated. And as far as hospitalization, the hospitalization of people who are vaccinated is 10 times less than people who are unvaccinated. And more importantly, the number of people who are vaccinated is 18.2 times less likely to die than people who are not. And these similar statistics have been shown in children. And so, as many of you know, the vaccine has recently been approved for the youngest of the children that can get the vaccine, which now includes all school-age children. So as of last week, the vaccination has been approved for children between the ages of 5 and 11. It was already approved for children between the ages of 12 and 17. So if we look at, why am I speaking about this? Because statistics show that Black children currently have lower vaccination rates compared to white children. And what are the reasons for this? Well, one of them may be access to the vaccine. And that not is, even though the vaccine is free and there's no cost, where the locations are that you can obtain the vaccine may not always be accessible to the neighborhoods where many of our Black children live. In California and in the Sacramento area, there is a concerted effort to not only try to work with local communities. UC Davis has worked with a number of the churches in the area to try to have access to the vaccine to be more readily available. And in fact, many of the health communities have actually gone through the process now of trying to get vans that will be mobilely able to go to the areas, be it schools or other situations where students are, so that access to the vaccine won't be a problem. What are some of the other reasons why the vaccine rates may be lower in the Black children? Black people have more skepticism about any new regarding any new healthcare interventions. And this is based on a history of numerous abuses caused by the medical community. So it is not an unfounded concern. Many of you may have heard about things such as the Tuskegee experiment, where essentially young Black men were purposely not treated on their infections of syphilis to see what the natural course of the disease is. And other situations include the use of cancer cells from one of the patients that ultimately resulted in a multi-billion-dollar industry for a number of healthcare agencies and pharmaceutical companies without any compensation or either notification to the patient that their cells have been used. Also, one of the problems that may be an issue for Black children and why they may not have the same numbers of vaccination compared to their peers in other ethnic groups is that if you look at it historically, Black children may be much less likely to have a well-established healthcare provider that therefore allows for a trusted relationship. Some of them may be getting their care through urgent cares or emergency rooms, as opposed to having a provider that they've established a long-lasting relationship and therefore feel comfortable in asking what may be often very difficult questions about and reasonable questions about concern for safety or whether or not it is in the best interest of their child to be vaccinated. So I just wanted to show you again from the Kaiser Family Foundation and just an overview again. This is from March of this year. through October of 2021. And what it's showing is that the percent of the total population that has received at least one of the COVID vaccines. And if you can see at the very top line here, the Asian community had the highest at 70%. The white population was around 54. The Hispanic population was around 52, and the lowest at this time was the Black population at 47. And given that those percentages that we've already talked about in terms of risk of being vaccinated and not vaccinated and conducting or contracting the COVID disease, and then once you have it, possibly being hospitalized and or unfortunately suffering a death from the infection, you can imagine how important it is, because we've demonstrated that if you are vaccinated, your risk of getting the disease is significantly less, and therefore the complications that are associated with it would also be less. So what I'd like to do is I'd like to give you an opportunity to hear from one of our pediatric infectious disease experts. His name is Dr. Dean Blumberg. He is the head of pediatrics infectious disease at UC Davis Medical Center and Medical School. And some of you may be familiar with him because I know that he was part of a previous presentation by this organization. Here's Dr. Blumberg.
After one dose of the Moderna and Pfizer vaccines, there's about 90% protection after about 2 weeks. With a second dose is recommended for longer lasting immunity. And it's the same with the Johnson & Johnson vaccine. It takes about 2 weeks to first start seeing that immune response, and then the protection builds from there. All three vaccines are highly effective, and I would have no qualms about taking any one of them. I don't have a preference for any of the vaccines. There's no problem getting a delayed second dose. We do try to get people vaccinated on time, so either 3 or 4 weeks after the first dose of the vaccine. But let's say the supply wasn't there, or for some other reason you got sick and you weren't available to be immunized. Just get vaccinated as soon as you can after that interval. You don't have to restart the vaccine series. And even if you get vaccinated 6 or 7 weeks later, the CDC says that dose is a valid dose and you don't have to restart the series. People who have COVID, we recommend waiting until you're no longer infectious, so you're no longer isolated or in quarantine, and then you may get vaccinated as soon as you feel well enough to get vaccinated. But there's no rush to get vaccinated because reinfection within 90 days of infection is very rare. So the CDC says you can wait up to 90 days later, but there's no minimum interval that you need to wait. We just don't know how long immunity is going to last. We wonder if we're going to need boosters and how frequent the boosters are going to be. So far, what we've seen is that the immune response following immunization is equivalent or better to the immune response that's seen following infection. So we expect at least 3 months of protection, and likely longer, but we just don't know. We're going to have to do those studies and follow up. People with underlying medical conditions such as heart, kidney disease, diabetes, lung disease, these people are at increased risk for having severe infections, so they certainly should be immunized. The CDC also recommends that they should be immunized unless they do have a contraindication to vaccination, and many of these groups were included in the studies. People who are immune compromised, the main concern we have is that they might be at increased risk for severe infection. People with mild immunocompromise were included in the vaccine studies, and they did seem to be protected and have a good immune response with no increased risk of adverse effects. People with more severe immune compromise were not included in the studies, but the CDC does recommend for them to be immunized because they may have protection from the vaccine, and there's no theoretical increased risk of side effects following vaccination. Pregnant or lactating women were not supposed to be included in the studies, but some women became pregnant in the studies, or they were missed. And so there is very little safety data, but there's no theoretical reason that we can think of that the vaccines would have an adverse effect on the mother, on the developing fetus, or on the breastfeeding infant. And so we think that that women who are pregnant or breastfeeding, that they may be vaccinated. They may want to talk to their doctor about that. When I talk to mothers about this, I've been recommending it because I do feel that the benefits of immunization outweigh the theoretical risks. We know that pregnant women are at higher risk for more severe infection compared to non-pregnant women of the same age. If you've had vaccine side effects, such as a severely sore arm or a bad headache or fever, after you've been vaccinated, you can certainly take antipyretics and anti-inflammatories such as Tylenol, ibuprofen, or aspirin, and that should relieve your symptoms. But it's not recommended to take those prophylactically. There's theoretical reasons to think that if you take those prophylactically before you've been immunized, that might decrease the immune response, and we wouldn't want that. I think if you're feeling sick on the day that you're going to get vaccinated, then don't get vaccinated, because if you get more sick, it'll be hard to know whether that was a side effect of the vaccine or whether that's the natural course of your infection. I think, the CDC and others still recommend universal masking when in public, when you're around people outside your household. That's the best way to prevent another surge of infection. We still have a significant number of people in the US who are still susceptible to disease, who have not been vaccinated, they haven't had infection yet, and so we still feel that we are at risk for additional surges. So right now, we're still recommending continue masking, continued social distancing.
Okay, I'd like to just make a few comments before I turn it over to our next speaker. So Dr. Blumberg spoke about all three of the vaccines that are available to the general public. However, since our focus today is really on the pediatric population, I wanted to make sure that you understand that as of right now, there is only one vaccine that is available to the pediatric population. It currently comes in 2 different doses. There is the regular adult dose that everybody was getting up until last week, which is available for young people between the ages of 12 and up, all the way through 18. After 18, you're considered an adult. And then there's the new lower dose, which is actually 1/3 of the previous dose that is available now for those children who are between the ages of 5 and 11. Some questions may be arising about what about the younger kids, and those studies are ongoing and we'll just have to wait to see. So I look forward to the other questions that may come up, but at this time, I'd like to turn it over to Patrice Hill, who is going to be sharing her information with you at this time.
Thank you so much, Dr. Lucien. I really appreciate the important information that we as parents need to heed as we continue to parent in a pandemic. Good evening, everyone. My name is Patrice Hill. I am just sharing a parent's perspective on parenting in a pandemic. I know that parenting looks different for us all. In the midst of this pandemic, we've had to essentially change and adjust the way that we parent. COVID forced us to not only be parents, but teachers, caregivers, health professionals, information seekers to best navigate this pandemic as parents and as people that are trying to protect our most precious beings, right? We spent 15 months at home with our children and isolated. And now as parents, we have to adjust to the new norm. Like many of you, my children went back to school this fall, and it was a big adjustment. I have 2 children, ages 16 and 10, and they both returned to school this fall. On the second day of school, I received a call from my son's high school that he was in close contact with a positive COVID test. He immediately had to be released from school. We had to get him tested as well as everyone in the house. And fortunately, he was negative. However, he had to be placed on a modified quarantine and immediately started missing instructional time. My son has not been diagnosed with COVID, but I've received those calls 7 times since the beginning of the school year. And we've had to get him as well as everyone else in the house tested every time we've received those calls. He's been placed on modified quarantine several times. And his last exposure was during the school day. And I really had to stop my whole day and go pick him up from school, get him tested, and he wasn't able to return to school until he had a negative test. He's missed approximately 35 hours of instruction time, having to wait on test results and being placed in modified quarantine. So as we're sending our children back to school, it's such a beautiful thing for them to be back in school with their teachers, with their peers face to face. But we're also facing this new set of challenges as parents, as we have to adjust to parenting in a pandemic. Our children being exposed to COVID at school, our children having to get tested on a consistent basis to ensure that they are not spreading or receiving the virus from school. It's been a challenge, and I won't say that it's been the easiest thing. And within 2 weeks of the beginning of the school year, my 10-year-old daughter contracted COVID. Now, at the time, the vaccine was not available to her. And when she contracted COVID, it presented itself as a normal cold with the sore throat. We immediately had her tested. However, when we initially had her tested for COVID, there was not a full nasal swab done because it was a modified version for children her age. Her symptoms persisted, and she eventually started having trouble breathing, and we ended up in an emergency room where she had a full nasal swab and tested positive for COVID-19 there in the emergency room. So as a parent, COVID-19 can present itself as a regular cold in small children, and I urge you to be diligent in how you monitor children with symptoms of COVID and also how you navigate it. After my daughter tested positive for COVID-19, it was an extreme challenge having to have her quarantine in the same house. It was one of the things that I really don't want to experience again, but also having to get everyone tested over again and being her caregiver while having a quarantine. As parents, especially when our children are sick, we want to comfort them, physically comfort them, allow them to sleep in our beds, allow them to be right there so that we can monitor their symptoms and ensure that they are safe. And I wasn't able to do that when my daughter tested positive for COVID-19. And it was really one of those points in parenting where I had to be mindful of how to keep myself healthy so that I could be her caregiver, and having to have safe boundaries in order to not get sick so I can ensure that she was healing properly. My daughter ended up missing 10 days of school and missed over 96 hours of instruction from her COVID-19 diagnosis. And so, I was so worried about protecting my children and making sure that they were safe while allowing them to go back to school and, be in an environment where they were emotionally and socially interacting with their teachers and peers. And in the midst of getting my daughter back healthy, mommy contracted COVID. And so again, I'm still trying to parent in a pandemic, right? Trying to ensure that my children are healthy, that I'm doing everything that I need to ensure their safety, making sure they have extra masks, hand sanitizer, that they have access to wash their hands consistently at school, and then mommy gets COVID. And so that was one of the hardest experiences for me as a mother, having to, again, quarantine in the same house with my children, not being able to handle the duties that I see essential to parenthood, like taking my children to school, waking them up in the morning, cooking meals, washing clothes, making sure that they do their schoolwork and are attending to their priorities. And I was completely isolated. I had to have family members step in to help me get them to school, to help me cook meals, to ensure that my children had the things they needed to, while their mother had to battle through COVID and be isolated from them. So I won't take too much more of your time, but what I will say is that we are still parenting in a pandemic. And as parents, and especially of parents of Black children, we have to be diligent in seeking information that is up to date, that is accurate, that can best protect our young people as well as ourselves, because we have a long way to go with this pandemic and everything has changed. And also as an educator, I'm in contact with school-aged children on a daily basis. And to see the way that COVID is playing out in schools, in sports, in school activities, it's making me realize how important it is for us to be ever present in health information and have constant contact with our children's pediatricians, their health providers, and understanding that we're their first line of defense against COVID. And we have to ensure that everything that they need to protect themselves from this virus is accessible, and that we have to maintain the resources in our community to ensure that we are doing everything we can to protect our children from COVID. After my daughter got COVID, after I got COVID, we have both gotten back to normal. But one of the things that I will attest to is parenting in a pandemic. We all know about the physical effects of COVID. No one really talks about the mental effects of COVID. I had a trying mental time during the time that I was diagnosed with COVID. I was able to get through my physical symptoms in about 7 or 8 days. But the mental effects of COVID, not being able to do the things I was used to, not being able to be around my children, not being able to cook a meal or pick my children up from school or attend important community events, really put a mental strain and almost had me feeling like I was off my balance. And so I just want to say we have to stay vigilant. We have to stay engaged. And we have to make sure that as parents of Black children, that we are doing everything we can to ensure our children's mental and physical well-being. With that, thank you so much for listening to me. I hope that as a community, we can come together and get the information we need to further protect ourselves from COVID-19 and be the best parents we can be in this pandemic.
Thank you so much, Patrice Hill and Dr. Lucien, for that wonderful and informative and also heartfelt presentation. And I wanted to also let folks know that this session is being recorded and it will be available for folks to view it on the UC Davis IDEA website as well as on the YouTube channel. So we will have that out shortly. So I really want to thank you both again for your leadership and your expertise. We have some time to take some questions from our attendees. And before we do so, please know that we have over 20 attendees at the webinar today. And we thank you for joining us and taking the time out of your busy schedules to really be with us and to hear this important information. We will be monitoring the Q&A box for your questions. And remember, that's at the bottom of your screen. So we really encourage you to ask, whatever you'd like to ask. And we will do our best to answer everyone's questions this evening in our remaining time together. And so I'm going to begin with some of the questions that are in our chat box here. One of our first questions that we have, and I think this is directed at you, Dr. Lucien, what are some of the ways we can better support our Black families to move toward vaccinating their youth when there are valid historical truths and current day fears? Do you have any tips that you could share with us?
Yeah, so I've had conversations with some of my patients and families around this. I can think of one in particular where the mother of the household actually had really bad diabetes and therefore would be definitely at high risk. and the father and the son, who was 17 at that time, he came in and were concerned about all of the historical things that I kind of mentioned, and were unsure about whether they should get vaccinated. And I said, well, I can tell you, I can't tell you everything that's in the vaccine, excuse me. But I do know that, your mother and your wife are going to be at higher risk if they get it. And so I think one of the things we have to realize is the statistics I just showed you, that if Black people get the disease, they're at higher risk of having outcomes. And those can be underlying health conditions that we already have, or we can have failure to have access to medical care, and therefore may delay in going in to be seen. And so I think we have enough experience now on the safety of the vaccine, particularly through the various ages now that we're down to the 5-year-olds, to say that it is quite safe for children to receive it. And then I think Patrice brought up a good point. Failure to vaccinate your child, because, although we're getting slowly towards the end of this pandemic, we are nowhere near that now, can result in even more detrimental side effects, such as lost days from school, and the mental things of, many of us are very well versed in what happened last year when our kids weren't able to go to school, and how much of an impact that had on them. So I think when you start weighing all those things, you have to be able to say, is there something that I can do to try to help my child? And the best thing you can do at this point is to have them get vaccinated.
So this is maybe a question for both of you. Do you believe schools should fight for 5 to 11-year-old kids for pro-choice on the vaccine as the government tries to force the vaccine?
Well, I mean, I think you get into a very tricky situation. And then right now, as far as I know, none of these school districts are mandating 100% that you have to get the vaccine. I know Sacramento Unified, because I've had a couple of patients, is now having a process where they're saying either you get vaccinated or you have to have basically an exemption that is done. And the nice thing is the exemption doesn't have to be just a medical exemption, which is required for the other vaccines that are required for school-aged children. One of them, it can be just personal beliefs. But the personal belief requires you to go in and have a conversation with your healthcare professional. And so the best thing I think is about that is that, at least if the parent decides they're not going to vaccinate their child, we know that somebody who is knowledgeable on the vaccine and the risk factors and things and the complications that we talked about, like the MIS-C and others, has had some kind of conversation, versus people who are making these decisions oftentimes with some information that they may have gotten off the internet, or they heard somebody who had this. And so I think that's where things should be probably most wisely right now, is that if you're not going to get vaccinated, you happen to be in the school district that's requiring it, that you at least have to go and sit down with somebody and talk about what the risk factors are, why the vaccine is important, before you make that decision.
This question is for Dr. Lucien. Should my 3rd grader who is experiencing failure to thrive, HF, ASD, SPD, and ADHD take certain precautions prior to the shot?
Yeah, there are no recommendations for any special precautions for anybody of any age prior to the shot. The only thing, as Dr. Blumberg mentioned in his video, is you shouldn't get it if you're actively sick. And that's not because the vaccine may make you worse, but it just allows you to try to make sure you differentiate what may be symptoms of the illness you already have versus a side effect from the vaccine. If you have some underlying medical condition, the statistics are quite clear that those are the people who are at the highest risk, if they do get COVID, of having a tough time, including asthma and other chronic medical conditions. And therefore, those children should be the ones that get the vaccine even more so than ones who are otherwise healthy.
Okay. I have a second question for you. Once my 11-year-old is fully vaccinated, what kind of safety protocols should I have in place to prevent them or anyone else in the family from getting COVID?
Yeah, that's an excellent question. And I think, again, Dr. Blumberg talked about that briefly. As of right now, because the number of people out there that still are potentially susceptible to the virus is significant. As you can see, some of the states, the highest percentages of people vaccinated, maybe as high as 70. There are some are in the 30s still. And so what you really want to do is make sure that you're doing all the hand washing and things that we would normally recommend in cold and flu season. But I would add to it an additional thing of wearing your mask whenever you're in a group setting, just because we do know that both the person who is trying to keep from getting the disease and the person who potentially could spread it, that transmission is decreased by wearing a mask. And so until we get to a point where the number of cases are so low, or we have a certain number of people percentage wise that are vaccinated, that's one of the best things. And then the final, of course, is avoiding hanging around people that you know are sick, because what you don't know is, as Patrice used the example of her daughter, what starts and seems like a cold could be COVID, and by the time you find out it is, you've been hanging out with them without a mask, and next thing you know, you got it, and then you take it home to your grandma, and something bad could happen. So it really is wise to be very cognizant of who you're with, and if it's people that you don't know, wearing a mask and washing your hands well.
Can unvaccinated children 5 and 6 act as vectors to spread the virus?
Yeah, so we do know that children, probably even more so than adults, can have what we call asymptomatic case of COVID, meaning that they have it and therefore they can spread it and have absolutely no symptoms, which is why when somebody is exposed, the recommendation is that that person at some point get tested, and up until the point where they can get tested, that they be isolated as best they can, because of the fact that even though they may never show any symptoms, they are not only having the infection, but they have the ability to spread it to others.
Do you think Moderna is better than Pfizer for kids under 12 years old?
So the only one that is approved through the emergency use authorization, both by the FDA and then ultimately approved and recommended by the CDC, is Pfizer. So if your child is under the age of 18 right now, the only choice is Pfizer. Moderna and the other J&J or Johnson & Johnson have yet to be approved through the FDA, even for emergency use for anybody under the age of 18.
Okay. And then the next one is, what are the cons to vaccinations?
So I think we talked a little bit, but probably the greatest con is the concerns that people have about what is the vaccine going to do to me. Some people have raised questions about, well, it was created too quickly. All the other vaccine, it was years before they was approved, and how come this was approved in less than a year? Well, the unique situation was that there had been research for years on using mRNA technology to develop vaccine. And when we were faced with a once-in-a-lifetime pandemic, the scientists who were already working for years on this process were able to quickly generate and create a safe and tested in many ways vaccine. So that's one of the biggest concerns that people have. The side effects, most people are not going to have any significant side effects. There are rare cases. Obviously, you have allergies, significant allergies. We're not talking about I'm allergic and to the weather and dogs and cats type of thing. But where you've had life-threatening allergies, that risk may be greater to having a reaction to the vaccine, and that's something therefore you would want to talk to your allergist or your healthcare professional about. To me, those are really the two biggest concerns.
Okay. When is a good time to get a booster?
Yeah, so as of right now, the only people who are recommended to get boosters are those who are adults, basically 18 or older. There is some question that if you are fall in the special category, I saw a patient today that has some compromised immune system, even though you're not 18 and you're in that 12 to 17, then that they may be eligible. Right now, the recommendation as far as Pfizer is to get that booster dose around 6 months, at least since the last dose that you got.
Okay. Patrice, you mentioned about the mental strain of dealing with COVID in your household. How did you manage to get through this?
Acceptance that I was diagnosed with COVID-19 and I had to fight if I wanted to still be here and still be the head of my household. You know, I had to tap into my spirituality. I had to tap into various forms of self-care, such as meditation and yoga. And I had to realize that I was in a unique situation of having access to all the tools I needed to be healthy, as well as understanding that I wasn't ready to go. And I wanted to, have a commitment to myself and my family that I was going to fight through this. I will tell you though, it took about 2 weeks, I feel like, for my mental clarity to I felt like it took 2 weeks to get back to baseline. There was a lot of brain fog and just not feeling like I was on baseline. So I definitely feel like acceptance was my biggest form of being able to cope with the mental strain, as well as understanding, what I was dealing with and who I was fighting for.
Next one is, my 11-year-old was previously all for getting the vaccine until recently. And this is the mom talking, received my booster and had very bad side effects. It took me down and out for about 2 days. Now my son has reservations about getting the vaccine because he's seen what I witnessed and what I went through. Certainly, I don't want to force him, but how do you recommend I approach this situation?
Yeah, and that's a tough thing. I mean, and from a healthcare professional, we might not minimize, but we might say, well, okay, for 2 days you had bad side effects, you didn't wind up in the hospital, you obviously survived it. So relatively speaking, compared to the COVID, it's not a big thing. But for the child who's 11 and sees their parent like that, it is a big thing. And so what you have to do is say that, yes, is a possibility that you can have a reaction. There are things you can do to try to minimize it. As Dr. Blumberg said, you can take Tylenol or ibuprofen to try to reduce any aches or pains or fever, keep yourself well hydrated. But of all the people who do get the vaccine and have some kind of side effect, those who have any significant side effect symptoms are very, 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 very small. And a lot of times when I'm talking to patients, I'll use an analogy of, things that we do every day that we would never consider not doing, such as driving a car, which can be far more dangerous than the side effects from a vaccine. And why do we do it? Because we believe that the benefits are greater than the risks. And that may be not something easy for an 11-year-old to understand, but most of them can understand because they do activities and things of that nature. So would I force my 11-year-old to get it? No, but I would explain to them that, the things that they want to do, the return back to the world as we knew it before 2019 when COVID came out, will only occur as more and more people get vaccinated and the numbers get to a point where it becomes more like the flu than this pandemic that we've experienced.
Should nursing moms get vaccinated? And if so, how soon after the baby is born should they get vaccinated?
Yeah, so if you happen to be a part of the presentation, you heard Dr. Blumberg talk about how the fact of the matter is, although they did not enroll moms who were either pregnant or nursing, some moms did get pregnant and therefore were nursing in the course of the trials as they were looking at it. The benefit, so one, it was safe for moms who are pregnant to get vaccinated, and the recommendation from the healthcare community is that moms who are pregnant should get vaccinated. For nursing moms, the benefit of getting vaccinated is that one, you're protected, and you getting or not getting COVID is the best way to protect your child, because of course your baby will not be able to get the vaccine anytime soon. The other benefit is that some of the antibodies that your body produces to protect you can get transmitted through the breast milk. They can't cause the baby to get the COVID disease, but may provide them additional protection beyond the protection that you would normally have. So all of those are reasons why it is a wise thing for moms who are nursing to get vaccinated.
What if I don't have health insurance? Can I still get vaccinated and get my children vaccinated?
Yeah, so the great thing about this is that this vaccine is absolutely 100% free to anybody in the country. And so that's far unique compared to a lot of countries where they're having problems with getting access to even having the vaccine, let alone whether or not they can get it free or not. And so in California, there are a number of different ways, but one of the easiest is you can go to the website that has been created. It's called turn, TURN .ca for California.gov. And if you go in there, and kind of walks you through exactly how to sign up and get an appointment for a vaccination. It will ask you who's the vaccine for, how old are they, is this their first vaccine, their second, or their booster, and then it'll give you a list, and you can type in your zip code if you live in a certain area, and it'll give you first, closest to you, places that are available to give you a vaccine, and it costs you nothing.
Okay. And then there's a question, can you get COVID through an earache?
No. You mean if somebody else has an earache? I want to make sure I'm clear.
That is just the wording that is in here.
Okay.
I don't know if it's someone else
Right.
or.
Yeah. So the only thing, as far as we know, there is not even a great transmission of COVID from objects. The way that COVID is usually spread is what we call droplet transmission, which is similar to, and most people are familiar with, the common cold. And so if you are the person who has COVID and you were to cough or you breathe really heavily or something of that nature, normally there is some emission from your nose and mouth of these droplet particles, which can travel probably maybe up to 6 feet or so. And that's why when you talk about having a close exposure, they define that as being within 6 feet, unmasked, because masks can help to block the transmission of those droplet particles, and for a period of time, because generally speaking, just being around somebody for a minute is not going to be long enough. And the recommendation when we're talking about what is a close exposure is probably 15 minutes or more. So just because you have an earache or somebody else has an earache, no. But if they had cold type symptoms and those cold symptoms were actually COVID, yes, you could get it from them if you're hanging out with them and neither of you are masked and they are, just talking right there in your face, let alone if they cough.
Okay. This question is for Patrice, but they'd also like to hear your perspective, Dr. Lucien, after she answers. How do parents deal with the practical aspect of COVID hitting their house? If my child or someone in the household comes down with COVID, what things did you have to do? They said that Noon told you about, such as extra sanitizing and things like that. So what extra precautions did you have to take? So they want you to talk about that whole experience there.
Right. So we know what the COVID symptoms look like, right? And what we have to do as far as isolating and taking care of ourselves. But no one tells you about the deep cleaning and sanitizing and almost frantic rearranging that you have to do. When my daughter was diagnosed with COVID, we were waiting for my son and myself's test results. And so because I didn't feel any symptoms, I automatically went into a deep clean. I cleaned the house from top to bottom. And it took me a lot of hours to do everything, right? And so no one tells you that you got to wash everything. You got to change toothbrushes. You got to change loofahs, and you have to change the things that you use every day. And you have to get rid of those things and buy new ones, right? I didn't realize I was going to have to wash every single piece of clothing in the house, right? And also having to wash rugs, and I got carpets cleaned. It really makes you reassess what deep cleaning means and what sanitizing means. And I don't think anyone necessarily prepared me for that. And then when I was diagnosed with COVID, I didn't have the ability to do that, right? But because I had already did it with my daughter, I was coming off of it already being sanitized. But also, no one tells you, like, as soon as you're back healthy from COVID, you have to do that same deep cleaning and sanitizing for yourself, replacing toothbrushes, replacing bedspreads and pillowcases, these things that we don't think about. We're just thinking about getting healthy. We also have to heal our homes, right? And scrub and sanitize them from top to bottom after COVID comes into your house. Dr. Lucien, you want to
Yeah,
add?
and I think one of the other things that Patrice kind of alluded to before is that, if you're a parent and your child gets COVID and they can't go to school, somebody has to take care of that child.
Right.
They can't go to daycare, they can't go to after school programs. And so that can be lost wages and other effects, particularly depending on what kind of work you're doing. And so the economic and also the psychological impact of all of that, it's not something that can be easily weighed or measured, but is real.
Definitely.
Okay, thank you. Are there any challenges with getting the vaccine and flu shot at the same time?
Right. So the CDC looked at that very closely, and initially, many of you, especially if you got your vaccines early on, you were told that you shouldn't get any other vaccines within 2 weeks of getting the COVID vaccine. Now we have enough experience with the vaccine to know that there is no contraindication to getting them both at the same time. So if you happen to need your COVID vaccine and your flu vaccine, you can get them at the same time. And there's no indication that you'll have any greater side effects or any problems with that.
Okay. Does the COVID vaccine cause infertility?
Yeah, so that's one of the big things that is out there. It changes your DNA, it causes infertility and stuff like that. The virus, even though it's a mRNA virus, it doesn't affect your DNA, it has nothing to do with infertility. And in fact, again, hopefully if you were listening, Dr. Blumberg talked about people who actually were part of the study and got pregnant during the time while they were in the study. And so there was no evidence of any increased miscarriages or any other problems for moms who were enrolled in the study of the vaccine and got pregnant during that time.
So we're just about at time here. I really would like to thank you again for your really thoughtful, informative presentation. I would like to invite Patrice Hill and Dr. Lucien to share some closing remarks with us before we end. So maybe we'll start with you, Patrice.
Definitely. One, I just want to thank everyone for being here, and thank DEI and UC Davis Health for allowing this forum to exist. It's so important, I think, as parents of Black children, that we understand that parenting in a pandemic is a new norm for us, and that we have to stay vigilant. We have to stay vigilant to give our children the best experience and protect their mental health and well-being, and to stay up to date on the most accurate health information, as well as school policies, and understanding that we are our children's first line of defense. We are, their parents, their teachers, their caregivers. We can be health professionals when our children are sick, and that we just have to, we have to understand that it's serious, that this virus is serious, and it doesn't seem like it's going away anytime soon. And we want our children to have the best life that they possibly can. And that starts with us understanding what we have to do to protect them to have that life. So let's stay vigilant as Black parents, and do whatever it takes to keep our children safe and healthy.
Thank you, Patrice. I'm going to share one last slide that just give you some resources that may be available. And as I do that, I just want to let everybody know that there are, you are the ones who have the greatest ability to be able to, oh, sorry, I did that wrong. There we go. Okay. You as parents have the greatest ability to help in this pandemic in relationship to your children. And although, you may have reservations, I think it is by your best job is to try to get educated, to have real conversations with healthcare professionals, or if you don't have one, resources such as the ones that I listed here that give out information so that you can make informed decisions, because the only way we're going to get back to what probably will be the new normal as opposed to the old normal is by making sure that as many people as possible are protected, and therefore we have less people who are susceptible to the disease. So hopefully the information that we shared with you has brought some insight and helped to answer some of the questions you may have about not only the disease itself, but the vaccine and ways that you can best protect yourself, your children, and your family.
And thank you again, both Patrice and Dr. Lucien. One last piece of information before you go. We will have a raffle for those of you who have registered tonight, and we'll be giving away gift certificates for restaurants in the Sacramento area like Fixins and other Black businesses that we will offer as part of that. So we'll be reaching out to you to let you know regarding the raffle if you want a prize. So please look out for that. And again, we thank you for coming, and we appreciate you and look forward to engaging with you again as more information develops around COVID-19 and keeping your children and families safe. So thank you so much.